Psychology: why do some men commit domestic violence? Experiencing trauma in early childhood can alter the brain, how the body responds to stress, and whether someone sees the world as a threatening, harmful, and untrustworthy place. For example, research has shown that people who have been exposed to trauma have increased activity in the amygdala of the brain, resulting in heightened fear and arousal that can lead to aggressive responses in the face of conflict and stress. These bodily changes can set kids up for PTSD, post-traumatic stress disorder, depression, and alcohol or drug abuse later in life, which are some of the most common risk factors of perpetrating domestic violence. One study found that nearly one-third of men in a domestic violence intervention program reported clinical levels of PTSD. Beliefs about traditional gender roles that dictate how men and women should act are another significant contributing factor to domestic violence. Unresolved trauma, mixed with rigid gender views, can limit the coping skills and tools people have to navigate complex emotional challenges in romantic relationships. For example, homes that promote rigid gender scripts, such as "boys don't cry," and limit opportunities to learn from activities that are considered feminine, like caring for baby dolls, can stunt the emotional expression of boys and make them less skilled in recognizing emotions in others and themselves. Anger typically becomes the most accessible emotion. Certainly not all people who have faced childhood adversity and trauma are destined to perpetrate violence. Studies show that a secure parent-child attachment and the presence of safe, nurturing relationships and environments during childhood protect against future violence. Positive childhood experiences, such as feeling understood in difficult times and having at least two non-parental adults taking interest in your life, can help. Without these protective factors, however, many children are at risk of carrying their trauma into their adolescent and adult romantic relationships. Prevention and intervention. Researchers are paying more attention to the dangers of social isolation among adults. This has been exacerbated by cultural shifts stemming from the COVID-19 pandemic, remote work, and social media. Interventions that focus on regulating stress and emotions, such as deep breathing and mindfulness, can help address physiological symptoms of trauma and reset the body's stress response. Resetting the body's stress response can then help people engage in the higher-level learning necessary to adopt non-violent thinking and behaviors and discard abusive tendencies.